thank you for joining us today. Today, City Council, in its capacity as Emergency Advisory Committee, heard an update from administration with more details about the aggressive spread and growth of COVID-19 in our city, growth that we're unfortunately seeing as we approach the holiday season. And we've also heard about the ways the city is currently doing our best to enforce the new health restrictions put in place by the province and encourage compliance with the voluntary measures as well. The city continues to lead by example in our own facilities and services. For example, we've continued to enhance cleaning measures on transit. We've increased enforcement in recreation facilities. We're developing and sharing winter guidance resources to help festivals and event producers adapt their events to be in full compliance with health orders. And we're working on communications campaigns that work in concert with business improvement areas and the Chamber of Commerce so that Edmontonians are aware of changes to services ahead of what is typically a season in which many of us find ourselves primarily indoors, as well as a number of other points that Adam mentioned today and we'll have some more to say about. Now, on enforcement, I've been hearing more requests, even demands from Edmontonians asking why we can't enforce the health orders more aggressively. And the answer is that we are doing what we can with the tools provided to us by the province. And while we're working closely with AHS on educating residents around the new COVID-19 restrictions and reporting violations, the city's ability for our peace officers to enforce measures still has not been renewed. Only AHS and EPS have the ability to issue direct orders. And while our police service is eager to and willing to help with enforcement, they are stretched quite thin as it is with other business. And so I would still much rather have the ability to dispatch our bylaw officers on public health issues. We've asked for this in the past and we will continue to advocate for it as the optimal deployment. Know, however, that right now our bylaw officers and peace officers are conducting inspections alongside AHS inspectors and EPS to help ensure compliance with the new restrictions. Now, I do want to stress that overall we continue to find through those inspections widespread compliance with health orders. 96% of businesses have adopted the new restrictions, which signals that the businesses are very willing to keep customers safe, and I hope we reward their hard work by supporting them during this holiday season, even with curbside pickup or e-commerce. Speaking of businesses working hard to comply with orders, I want to stress that the health of our economy is directly tied to our compliance with the health orders, including the city's mask and face covering bylaw, and the renewal of that bylaw is coming now to City Council tomorrow. And I want to stress that there is widespread public support for the mask bylaw. This widespread support has been expressed in surveys the city has done, in polls that the media have conducted, and is reflected in the widespread compliance among Edmontonians with the mask bylaw. So by and large, citizens here understand and agree with the science, which states that masks are effective in helping to prevent the spread of COVID-19, period. However, this is in addition to the hundreds of emails my office and council have received from Edmontonians in support of our mask bylaw, because Edmontonians, by and large, understand that self-care is community care, and that wearing a mask is a relatively simple thing that we can do to each help curb the spread. Again, overwhelming buy-in from Edmontonians in my view. And I know that Edmontonians are tired of the virus and ready for all of this to end, waiting patiently for a vaccine, but we must accept the reality of the data before us, which is that COVID-19 cases are rising and fast, and we need to remain vigilant by following all of the public health orders. I also want to stress that I am very eager, and I believe Council is too based on the discussion this morning, to work with the province and with the Premier and Dr. Hinshaw on even stricter measures should the province enact them. They have the strongest authority to issue regional health orders, which I've long maintained is the key to tackling the spread of this virus in our metropolitan context. COVID-19 is borderless, and people across our region need clear and concise rules so that there is consistency in Alberta's approach to tackling this virus in the Edmonton metropolitan region. That's why I've begun reaching out to mayors across the Edmonton region to talk about a coordinated approach should we need to go down the route without a direct order from the provincial government, and for us to take coordinated measures under the local authorities for emergency management, which are more limited than the provinces, to be crystal clear. Now, I'm happy to say that those conversations with my colleagues around the region and other mayors elsewhere in the province as well are going well, and there is a very strong willingness and understanding among many of our neighbors and other mayors that a patchwork response to this virus will not be effective, and that we need to band together to ensure we're healthy together as a region and as a province. And I was also very happy to hear today that City Administration has also begun early conversations with our regional partners, as well as the City of Calgary and folks from the University of Alberta who have expertise in these areas, to explore additional measures or steps that municipalities could take on our own should the need arise. Now, it was also good to hear an update on how the city continues to work to support vulnerable populations here in our city. Since we last met at EAC, the city has facilitated the opening of a 24/7 low-barrier temporary accommodation at the Convention Centre, which is being operated expertly by agency partners, and also worked on supporting other 24/7 accommodation spaces across the city with hope and with mustard seed, so that folks aren't forced to weather the pandemic out in the cold. Now, I advocated hard for these spaces to open up so that we could get folks out of the cold in time for winter, and now that we've done that, my focus has returned to finding a permanent solution for homelessness, which is housing. City Council continues to prioritize the creation of hundreds of units of supportive housing so that we can end homelessness, and we've updated our housing strategy so that we can quickly increase the support of supportive housing, the supply of supportive housing units in the coming months, just this week at Council. So actions the city has taken recently also include opening bridge housing at the jockey barns and hotels to help transition people into housing while we work to build out other housing projects in the coming months. But the city cannot do it alone. Housing and homelessness are properly jurisdictions of the federal and provincial governments, which is why we're working so hard to advocate for their continued involvement. And I'm continuing to advocate with mayors across the country so that we can help the federal government reach its now solidified goal of ending chronic homelessness in Canada. And specifically, I'm joining fellow mayors this week in calling for a scaling up of the Rapid Housing Initiative, which is a clear path to ending homelessness in this country. Provincial support is also key in our combined work to end homelessness across the country and across our province. For Edmonton's plan to be a success, we still need the province to commit to ensuring on-site health and social support services, including mental health and addiction supports, supporting recovery for people who've had complex needs over the years that haven't been met in the system. And so that those services can be embedded in bridge and supportive housing units, and for them to also support the cost of rent supplements for vulnerable people. So continuing conversations, productive conversations with the province of late about coordinating our efforts on ending homelessness. And next week I'll be meeting with the Premier, and I hope to get some positive signals in that meeting that will allow us to move forward in lockstep all orders of government to better support vulnerable people in the second wave of the pandemic here. Finally, I want to end today on a note of thanks again to frontline workers. Back in the beginning of this pandemic, we were ensuring at every meeting and in every gathering that we took time to thank our frontline workers. And so I want to take a few moments of your time to express the deep gratitude that the City of Edmonton has for all of those folks who are currently, again, in the second wave, facing tremendous strain. Your city is very thankful for your service. And I think Edmontonians are by and large trying their best to follow the health orders so that we can alleviate the intense pressure that frontline workers, particularly in the health system, are facing. So thank you very much. I'll turn it over to Adam, and then I'm sure there'll be some questions.
Thank you, Mr. Mayor. Good afternoon. Thanks for joining us today. As the Mayor mentioned, today at the Emergency Advisory Committee, we provided an update on the city's action plans and the plans to help try and prevent the spread of COVID in Edmonton. This is the first Emergency Advisory Committee update since the province introduced a 2-week escalation in targeted public health measures. The recent surge in COVID cases, hospitalizations, and ICU submissions in the Edmonton Health Zone is troubling and an indicator that basic public health measures are not firmly entrenched habits as we hoped they would be. AHS data suggests that many of the concerning behavior occurs in private social gatherings. Aggressive community transmission like we've seen over the past month requires a comprehensive and serious response. The province's latest targeted restrictions limit the number of times and places that people can come in close contact with one another. The city plays a support role in amplifying and echoing that strategy. We have reviewed internal and external facing practices, procedures, and capacity limits and make adjustments as needed. Changes to services and service delivery have taken place across the organization. Some, like reduced spectator seating in recreation venues, are subtle adjustments, while others, like the cancellation of New Year's Eve fireworks, will have a bigger impact. We've recommended an extension to the face coverings bylaw, which would continue to apply to all enclosed publicly accessible spaces and allow exceptions for specific situations and individuals. The bylaw amendment will be discussed tomorrow. With the closure of Camp Pekawewin, the city's support for those experiencing homelessness is now focused on the operation of 24/7 temporary pandemic accommodation sites: the Edmonton Convention Centre, Commonwealth Stadium, and the Southside Mustard Seed location collectively offer 520 shelter beds, and approximately 200 to 250 are available on an average night. The current challenge for agency operators is finding isolation space for individuals who have tested positive or who have come in close contact with a positive case. We are aware that the November 27th end date to the current restrictions may not show sufficient change to the epidemiology data to warrant a relaxation in measures. A new round of more stringent measures could also be introduced in the lead up to the holiday season. As a result, the city continues its second wave escalation planning efforts and is exploring actions with regional partners. COVID knows no geographic boundaries, and so a broad, consistent approach to slowing the spread may be our best defense. We are at a crucial crossroad that requires support and discipline of the entire community. We urge Edmontonians to redouble their efforts to keep themselves and those around them safe. Thank you, and happy to take questions.
Thank you. We have 6 media outlets joining us today virtually. First, we'll go to Carly Robinson with City TV.
Hi, my question's for the mayor. From lots of council members, it sounded like there was frustration over the communication and sort of the path forward with the province. I just want to know how you're feeling about how things have gone through that communication.
Well, I certainly heard quite a bit of frustration from members of council today. I think they are challenging frustration that we are hearing from Edmontonians. As case counts rise here quicker than I think anyone is comfortable with, and as we are now sort of winning the losing race with this virus, with the exception of Airdrie, which is the other outlier in Alberta right now, I think there is tremendous anxiety and concern among entrepreneurs who are concerned about their employees and want certainty about what the next little while will look like for them, from people who either have higher risk conditions to begin with, or who have family members or loved ones who have who are at higher risk with this virus, and folks in the health system or who have loved ones who work in the healthcare system on the front lines who are hearing those strains. So as a healthcare delivery center for Northern Alberta, I think it's especially keenly felt, and I think councillors are channeling that concern that is shared widely across the city. And I think there is a sense of frustration, and I wouldn't say powerlessness, but constraint, because local authorities have some tools to respond to a pandemic, but they are limited compared to the province's tools and access to information to inform how to use those tools. And so I'm sensing from Edmontonians and from my council colleagues a desire for the government of Alberta to act more strongly and swiftly to keep the virus from breaking wide and loose in the community and overwhelming our healthcare system, which would be tremendously disruptive to consumer confidence at precisely the time where we're all working together to keep workplaces safe and keep the economy going. And so this false dichotomy of lock down or keep everything going, I think stronger measures are needed and needed soon, and we will continue to encourage the government of Alberta to go in that direction. But I do sense mounting frustration among my colleagues and among Edmontonians.
Thank you, Carly. Do you have a follow-up question?
Yeah, I'm just curious. You talked about meeting with some of the mayors and the councils of the bedroom communities around Edmonton for some sort of action if we don't see it from the province. Do you have any indication of what that action could look like under the constraints we have of current legislation?
So it's too soon to say. I think, opinions vary. Certainly there are folks out there calling for circuit breaker lockdown. There's a spectrum of options above and beyond the restrictions and guidelines that are currently in place. So there are trade-offs and impacts to the economy with any of those measures. And again, the province is in the best position with their dashboard of the epidemiological data and what's actually happening in the healthcare system to make those decisions. But I think mayors around us in the region are hearing the same concern and are also thinking in a borderless way around it. So we have the ability under states of local emergency to put measures in place to protect public health and check the spread of a pandemic. We were prepared to use those measures in the spring for the city when the virus was largely in the city. But for that to work, we would need to enact similar measures, and also, to be fair to people and businesses, similar measures from St. Albert to Beaumont, including the city of Edmonton, Strathcona County, for this to work. And that's a difficult position to put local officials in, to try to coordinate that. But I've started those discussions. Administrators and city managers and county managers have been having some of those discussions. We'd prefer not to go down that route, because at the end of the day, the province does have a hammer over all of this, which is that they can countermand any order put in by any municipality under a state of local emergency. And so to go down that road and then to be countermanded would also be mixed signals to people. And so again, we'd rather not wind up in that situation. But it's a very disempowering situation right now, frankly, and we're looking for what we can do. And I think the first thing we can do is continue to advocate for stronger measures than are in place right now.
Thank you, Carly. Next up, we'll go to Dan Grummett with CTV.
Hey, thanks for taking my question. It's for the mayor. You said, I guess I just want to ask you, you said you want stronger measures, you think that they're needed. Are you saying, do you agree that you believe that the current measures and the new restrictions that were brought in November 12th are inadequate?
This is the challenge, is that I don't have access to the epidemiological information, the tracing, and based on what the answers we heard today and the information that's been in the press, I'm not sure that anybody has that information to make the targeted measures that might be required, which is why people in the absence of that information are going to circuit breaker lockdown. And I think that might be further than is necessary. We did not have a lockdown in the spring, but we were able to flatten the curve with greater limitations on gathering and more people working from home, and select closures of certain kinds of activity that present risk for contact and transmission, and essentially a broad stay home kind of directive. And I think that is, generally speaking, the direction that we should be going at this point, unless we can all be convinced otherwise with evidence that the tracing is sufficient to show that there isn't widespread and unchecked community transmission. But my sense, and what I'm hearing from the public sense, is that this is getting away from us. And so some stronger measure to limit contact, limit activity, and have people stay home and not gather in any large numbers for some period of time, just as we did in the spring, is what it would be necessary. And that's not necessarily a full lockdown, but it is a significant restriction on movement and gathering for a period of time to check transmission.
Dan, do you have a follow-up question?
Yes, please. You mentioned, Mayor, that you want the ability again to dispatch bylaw and peace officers on public health issues. Can you just give me an example of a situation that you're seeing arise that you feel these powers would be necessary?
Absolutely. If a transit peace officer sees a group of people, more than 15 people clustered together, they can ask them nicely not to cluster together if they're not observing physical distancing and if they constitute a gathering larger than is required, but they cannot issue a ticket in that situation. And they need to be empowered to be able to enforce those requirements for them to have teeth in every situation where someone with a badge and a crest on their shoulder ought to be empowered to ask nicely first, but if people don't do the right thing, which by and large they do, I think we weaken the ability of our enforcement officials to bring home the seriousness of what we're dealing with here by limiting them to asking nicely, which, unless there's an AHS officer, public health officer with them, or a police officer with them, they're really on their own. And it's an irony that they can write a ticket for the mask bylaw because that's a civic bylaw, but they can't write a ticket for not observing physical distancing if both of those things are happening at the same time. I really do think it would be a helpful signal of partnership from the provincial government to empower our bylaw officers, who are very well trained in how to do this in a tactful way without escalating with people, but give them the tools, because I do think we're going to have to move into stricter enforcement all around here, both of the mask bylaw and the city's side, as well as whatever restrictions are in place and might come into place from the province. All the tools in the toolkit need to be deployed, and now.
Thank you for your questions, Dan. Next up is Dustin Cook with Post Media. Go ahead, Dustin.
Thank you very much. Question is probably for Adam. Adam, if additional measures are deemed to be required, would they likely be reflective of level 3, which includes public transportation and retail properties, public spaces? And would the plan be to have those come into effect before the provincial measures possibly expire next Friday?
Thanks, Dustin. First question, I think it actually would consider those in level 3 and potentially level 4. I think we're open to assessing any of those on the basis of their ability to help prevent the spread. So I think this assessment is considering all options. As it relates to when, really tough to answer that question now. I think you heard today from Council, Emergency Advisory Committee, that there's a desire to act quickly. And so our assessment over the next little while here will identify some opportunities, and based on the ability to implement, you may see action happen before the 27th, but it's too early to be definitive on that right now, Dustin.
Dustin, do you have a follow-up?
Yes, please. I wanted to quickly follow up on the enforcement question. How did the city lose the power for bylaw and peace officers to enforce these, and could a state of a local emergency be enacted to have that power back?
So we've never had the power under a state of local emergency. We could. However, legislation changes early on in the pandemic identified that if a community or a municipality wanted to implement a state of local emergency, it could be removed by ministerial order by the province. So that's the challenge we have, as the mayor noted, is that we don't have that power. We never had that power under the state of local emergency. We could have, but that state of local emergency could be removed by the province under a ministerial order. So we're really in a tough situation in terms of being able to enforce the health orders, other than the way the mayor described it, which is ask, alert health authorities or the police, and that does create constraints on the system.
Thank you, Dustin. Next up, from Global, Vinesh Pratap. Vinesh, are you there?
I am. Sorry, yes, it was on mute. I kind of want to follow up on Dustin's question and maybe get a political response from the mayor. So please correct me if I'm wrong. So from Adam's response, if the city does instate a local state of emergency, does that give peace officers the authority then to issue fines? And so, you're understanding that the province could rescind that, why not just take the step and just see what happens, I guess?
So there are two separate issues, I think. One is that peace officers would have the ability to enforce municipal public health orders under a state of local emergency if the province didn't countermand the order. And I'll just double check with Adam. I think it's that the province can't lift the state of local emergency, but they can strike down any orders issued under the state of local emergency, rendering it moot, but they would go on an order by order basis. The minister, with the stroke of a pen, can override the local authority. So in that case, we could start to enforce, and then if the order is struck down, then we would no longer be able to enforce. The case of the peace officers is that there was a ministerial order in place granting municipal peace officers the ability to enforce provincial public health orders. That expired in June and hasn't been renewed. What we're asking for in that case is for that order to be reinstituted by the province so that the province's rules can be enforced at all levels. So two separate issues, I think. And again, the optimal solution would be the province taking strong steps and empowering municipal partners to help educate and enforce them with all the tools in the toolkit. Plan B or fallback would be using the limited municipal emergency management tools at the risk of those orders that come from the emergency management agency in a given municipality being struck down by the province.
Vinesh, do you have a follow-up question?
Yeah, so just with that, why not just try to, take the local steps and see what happens? Because is it a guarantee that the province would strike down or circumvent the municipality, or is it just a fear that they could? And so why not just kind of take the steps and see what happens, I guess?
Well, the first step for me, as I emphasized, is making sure that it wouldn't just be the City of Edmonton acting alone, because I think that would create a very difficult situation for our businesses and ambiguity and confusion for residents in a borderless region. So the first step before local governments could take action would be to ensure that it would be coordinated action, at least within the metropolitan region, and perhaps with Calgary and the other mid-sized cities who are starting to see concerning and rising case counts and have similar concerns. So building that coalition, as it were, of municipalities willing to use that authority before actually stepping into it, and also continuing to advocate and hoping that it'll be done by the province in the meantime, while putting the steps in place to take a coordinated response across a number of municipalities. And then the question would be, and we haven't heard one way or the other from the province, it's just that this rule was brought into place in the spring. In the past, municipalities had full autonomy to manage states of emergency locally. That autonomy was circumscribed with legislative changes in the spring, and no one knows how those would be used. It's just a risk. A message from the province confirming that we would be empowered and enabled and respected to flex local jurisdiction as we have with the mask bylaws. The Premier's comments yesterday on the town hall were very supportive of individual municipalities taking action within their jurisdiction on that front. Some reassurance that should the need arise that local autonomy would be respected on these other measures would be helpful. We haven't had those conversations yet. It's one of the themes I'll be exploring with him next Tuesday when I speak to him about this and a number of other issues that we're trying to find common ground with the province on, because we'd like to help. That's bottom line. We'd like to help protect life and the economy in a coordinated fashion for all residents of our city, our region, and our province.
Thank you for your questions, Vinesh. Next up, we have Jeremy Thompson from CTV.
Hi, another question for the mayor. Just throughout the meeting this morning, a number of questions were asked to Dr. Zachary, and he wasn't able to answer, some of those. What does it say to you that the medical expert that you're sort of leaning on to have the answers? What does it say to you that even he doesn't have, the answers you're looking for?
Well, I don't know which is more concerning, that they don't have the answers or that they're not willing to share them. And this is the challenge that provinces and federal governments face, because everything that ultimately has to go to Cabinet for approval is subject to Cabinet confidentiality. I suspect and hope that they have much more information than they were able to provide today that's informing decision making, but that it's not in a state to be released because of Cabinet confidentiality and the very tough decisions. I sympathize with the government of Alberta and the medical officers of health working together along with the political decision makers that they're grappling with. So I hope that means tough decisions are being contemplated based on more data than is available to the public and partners at cities right now. But I also empathize that it's a very fast-moving situation right now, and that because of the situation we're in with respect to contact tracing and the unknown spread, the data appears to be, and many councillors noted this, that the data appears to not be robust enough to design the targeted measures that might be required. But I would love for us to all be proven wrong on that, and this is where I think municipal tendency is to err on the side of transparency. Provincial and federal governments are just structured differently, and I suspect that's part of what's at play.
Jeremy, do you have an additional question?
I don't, thank you.
Okay, thank you. Next up, Natasha Reeb from CBC.
Hi, thanks. I think this question is for Adam. Thanks, Mayor Iveson.
Go ahead, Natasha.
Hi, Adam. This is regarding what bylaw officers are empowered to do regarding mainly the face covering bylaw. And I've heard, or I got it from communications, that since August 1st, there have been more than 2,000 complaints about the bylaw or people not heeding it, and only 4 tickets given out. So when we talk about, enforcement, I know that thus far we've been focusing on education, but if a lot of people are getting fatigue and refusing to do that, would that be one of the measures that you might suggest next week?
It's a measure we're considering to be a little bit more firm with our enforcement of the mask bylaw. I think one of the reasons that we continue to do the education path and ensure folks understand before taking the enforcement approach is, when we look at the areas where we're monitoring, which are public-facing settings, compliance is quite high, which goes to my comments at EAC today that, even though we don't have all the data, the trends are that it's not in city facilities or city infrastructure or in businesses where we're seeing these concerns. It's the private social gatherings where we're seeing these concerns. So, and then the limitations of being able to enforce the mask bylaw in private settings. So That's where it's challenging for us in terms of enforcement, but it is a measure that we're considering in terms of more direct tickets.
Sorry, if you actually look at the graph on Alberta Health Services website, and Andrew Knack brought this up, you know, it's still about 50% of the cases are from an unknown origin. So I don't understand, you know, this is confusing for everybody, but it's possible that, for example, transit bus drivers that are not wearing masks because they've got the shields. I mean, some people are flagging that as a worry. Some people are saying that they're worried about taking public transit because some of the bus drivers aren't wearing masks.
Well, I respectfully disagree with that comment. You know, our bus drivers do take the necessary safety measures to ensure that they're limiting the spread. We do want to create a safe environment. Masks are mandatory for users on transit. The unknown cases are a concern. And again, we're limited here in that we rely on the information from the health authority, and the health authority is identifying the main driver around transmissions are private and social gatherings. But we are considering firmer measures that include issuing tickets in correlation to our mask bylaw.
Natasha, do you have a follow-up question?
I just wanted to revisit, I'm not saying that drivers aren't following the bylaw. I guess maybe I'm wondering whether amendments to the face covering bylaw might be considered in that, from my understanding, if the shield is up, then the driver isn't required to wear a mask. If that shield is closed, would you consider changing that?
That's a procedural item that administratively we would make. We're not considering amendments to the bylaw at this time. The bylaw is in front of council tomorrow, and really what we're looking for is an extension to the timeline on the bylaw. It's set to end at the end of this year, and we're looking for an extension to that, but not considering other amendments.
Okay, thanks.
Thank you, Natasha. Thanks to Adam, Mayor Iveson, our interpreters, and the media for joining us today. Have a good afternoon.
Thank you.